Hey everybody, it's Dr. Jess and Paul Burgess again in our next installment of Solving the Health Puzzle. Why am I sick? The real reasons. Last time we were together, I talked about a patient of mine who had four-stage cancer, who is doing very, very well now. And I told you a little bit last time about how she got that way by not only doing the things that I asked her to do, but doing many other things. What we didn't really talk about was her level of commitment. Uh, this was a life-threatening, immediately life-threatening illness that at the point that I spoke with her, she had several things she was attempting to do, didn't have it organized. And then when she had a little bit of energy from the stuff that I asked her to do, she organized herself and actually from sunrise to sunset, or from the time she woke till the time she slept, she did certain things spiritually, nutritionally, physically. And I told you that at this point, and it's only like 4 or 5 months later, that she's out, she's walking around, she's driving her car, which I found pretty amazing and a little scary, and is just progressing in life right now. But her level of commitment was 24/7. Paul and I spoke about this concept with our own patients. And I noticed in my patients and he and his that those people who are committed to working not only the program, but whatever's necessary to get back their health or maybe achieve health for the first time are the ones who are successful. And it's something that I haven't really talked too much about with my patients, but Paul does all the time. So I've asked him to talk a little bit about the necessity and intensity of commitment based on whatever you guys, whatever you and your practitioner decide, but the willingness of the individual to commit to achieving health and how, why, we all talk about faith, maybe in religion, that if you have faith as small as a mustard seed, you could tell that mountain to move and it would move. Isn't that just really commitment? Isn't that just a deep faith or deep knowing or deep not even understanding, but just knowing that this will happen if I do the proper things? And then the willingness to change your habits, albeit slowly or quickly, to achieve that goal. And I don't know nobody better in the world that can explain the components of this and what exactly to do than Paul Burgess himself. So there you go, buddy.
Oh, mate.
That's my way of an introduction. Okay.
Before we get into it, I had a patient yesterday. It wasn't a patient; she was a first consult. Very, very aggressive ovarian cancer, and 12 years ago had breast cancer and dealt with that. Was on a medication for 12 years, came off the medication, and then got ovarian cancer very soon after. And she's literally on chemo now. And basically the oncologist is saying, look, this will last 4 months, and then we might be able to do one more thing after that. But, we're at the end of our kind of program now. And so she's staring down like 4 to 6 months left of her life. And she was so upbeat and so proactive. And she said, my diary is full. Right, I've got things to do for every day, all day. I'm just so busy. And her commitment was, whatever it takes, I'm going to keep doing it and keep doing it and keep doing it. Because in fact, 18 months ago, her oncologist said, you might only have 3 or 4 months left. So everything that she's put in has continued her to where she is. Now, the reason I'm bringing it up, and we will get onto commitment, I promise you, is that this is another thing that we see quite a lot, especially in cancer patients. They're treating the cancer, right? They're treating the symptom. Not one person has looked at, is there anything driving that stuff, right? No one's looked at heavy metals or mold, toxicity, industrial pollutants, chemical pollutants, anything like that in her system. And so it just baffles me why, after all of this time, years and years and years and years of having bouts of cancer, that no one's ever looked at it from that cellular perspective and said, look, we need to see what's driving this. Bizarre.
Well, that's because the allopathic profession, especially specialties and subspecialties, look at the one thing that they're fighting.
But
And
no,
especially oncologists, they don't want you doing anything else because it might interfere with their attack on the cancer cells.
yeah.
It's up to us really to bring that kind of information and that type of treatment to the world.
Yeah. So when we're looking at patient commitment, I think there's a couple of things we need to be very careful with. Firstly, a lot of patients or a lot of people trying to get their health back are under the misconception that if I just do this 12 months of work, I'll be fixed and then I can go back to doing what I'm doing now. And that's a really bad way to look at things.
It is.
Because it's what you're doing now that's caused the problem, right? It's not a normal life to do those things for you. It's not a healthy life to live the way you are and expect things to change without having to permanently change them. So when people kind of turn around and say, okay, well, it's a 12-month thing, and after that, I'll be fixed and I'll be fine to go, live my normal life again. There's a big educational piece there. They need to realize that this is not going to happen. And these are the reasons why it has to stay the other way. So that's the first thing. They've got to be committed to that. Not only the time that you're working with them, but then after that, know that it has to go on down that road. But also during the process, and that's why I developed this protocol where I see my patients at least every 2 weeks, and definitely have conversations with them and contact with them every week or more. It's a very consistent piece of work that's done, almost certainly weekly and bi-weekly on a call, so that we keep up to date with everything, because everyone needs to be steered in a certain way. You always need to be nudged on the right track. You can't just be left to go on and do your own devices. But the ones that are really committed are the ones that I always get feedback from. Before I reach out to them to say, how are you doing today, Jess? It's always like, Paul, got up this morning, this happened. I had that yesterday. I'm wondering if it's connected. What do you think? And they're always being proactive in what they are doing themselves. Right. So that makes life a lot easier for me, because it keeps me up to date exactly what's going on. But also it allows us to really drive the direction of the treatment in a way that suits them. Because if they come up with a hiccup in the middle of it, or I've got this breakout of something we weren't expecting, go, right, okay, why is that? What's caused it? Have we missed something? Oh, actually, maybe we haven't checked that as we should have. Let's go back and do this. And that's why it's so fluid. So people can be their own best detectives, and then they feed back to me, and then I'm able to steer them back on the right course. But it's having that commitment every day to follow through those things. Right? Am I eating correctly? Am I getting the right rest? Am I getting my sunshine? Am I getting my exercise? Am I getting the right water? Have I stopped using those pans? They've got aluminium in them. Have I had a conversation with somebody today, got very high aluminium? Where do well, I don't know. I'm never exposed to aluminium. So go and get your deodorant for me. Let's have a look at that. Second ingredient, aluminium, right? Which is in most people's deodorant, right? So that's the first thing. And then as he started thinking, he started coming out with all sorts of things as well. Where we store the tea, the canister we store it in, that's aluminium. He said, and I also buy tea bags that are in tin foil, and I keep them in the tin foil until I use them. And then he said, and then also I've got a deep fat fryer that's made of aluminium. And then we don't use it often, but I might use it once or twice a week. And it's like, hang on a minute. Right?
Yeah.
If you've got
Start adding it up.
Aluminium at high heat in an oil, some of that is going to leach into it. And if you've had that for 30 years or whatever it is,
right,
plus do this and that and the other, the whole thing starts piling up. So it's when people are that invested in themselves that they put in the commitment because they want to get the value out of it. Where the challenge lies is that the wrong kind of patient comes into us, and they're like everything else, right? It's like, if I pay someone to wash my car, I don't need to do anything. If I pay someone to build my extension on my house, I don't need to do anything. But if I pay someone to fix my health, I still have to do all the work.
Right. Exactly.
And that's a concept people don't get.
True.
Think, well, what do I need to, why can't I just take that vitamin D and that antioxidant and I'll be fixed, right? I don't need to actually change anything else. I need to be more aware of where my body is or how it feels, or, why can't I work till 2 o'clock in the morning? I've got a business to run. Well, no. let's have a big discussion about all of that, right? This stuff is not going to keep you going. That's what doctors do, right? Doctors manage your sickness, right? And I spoke about this online a little while ago. Statins, blood pressure meds, gout meds, diabetes medication, whatever you want to call it. That is just managing the sickness that you've
That's
got.
right. That's exactly true.
There's no health being promoted there.
There's no cure. There's no curative intent. It's managing chronic illness.
So it's just like, we'll manage your sickness and keep you from getting sicker.
Or slow down the progress.
Yeah, but if you want to get healthy, you need to start putting some effort into it. And those patients who go, yeah, I'm down for this, what have I got to do? You tell me and I'll just go and do it. They are the ones that get the best results.
It's true.
Because you have got to do that. You've got to put the effort in. It's like anything you do. If you want to be good at school, you've got to put the effort in. Right? You're not going to just wing it and turn up at an exam and pass all your papers. And it's the same sort of thing with this. But people still think this old culture of go to the doctor, get a prescription. That's all I need to do. I don't need to change anything. Doctor said I shouldn't eat so much fried food. All right, well, I might cut down for a week or two. It'll be fine after that. No.
We've been lulled into the pill for the ill, that there must be some simple, quick solution because that's what we're constantly bombarded with. And we don't have to do anything about it. Just take this pill or, drink this substance. And, Madison Avenue or the advertisers have been doing this to us for years. If you do this and this, if you dress this way or smell like this, your life will be good. The pharmaceutical industry just says, if you take this, if you're not feeling happy all the time, take this and you'll be happy all the time. And if that's not working, we've got something else for you.
And sorry, just on something slightly different.
Okay.
I'll be interested to get your opinion. I think other people would like to hear this. There was a program on the BBC last night in the UK talking about menopause, and I was watching it, and I was kind of like, "Oh, mate, what is going on?" They're giving the information they were giving was much better than the usual information, and they'd actually taken it a step further, which is really good. But the reason a lot of women came off of HRT not long ago was because of the breast cancer scare.
Right.
And they kind of talked about the paper that did that and showed it was flawed in a lot of areas.
Mm-hmm.
But here's the thing that I've not heard anybody do yet, right? HRT, TRT, whatever hormone thing you're doing to replace. No one, it's certainly not in the mainstream. There's no one in the mainstream. Some of us practitioners, I would have thought, are doing it. No one is measuring the pathway that those hormones are going down. They're just going, you put them in and you'll get this result. And here's the generic dose, and everyone takes it. Now, bioidentical hormone replacement is compounded, and they do look at, what your specific levels are, and they make it specifically for you, and I get that. But this whole cancer scare thing is basically on the fact that the estrogen's going down the wrong pathway and creating the DNA damage and estrogenic cancer. But no one's measuring that. And it just seems bizarre to me that such a simple thing can be the key to people's lives, women's lives who are going through menopause, being phenomenal and with no risk or very, very little risk and done properly, right? And again, that, when we're talking about commitment, that is another form of commitment from practitioners to get patients to be better in the right way, instead of just saying that all the doctors say this, the research says that, that's the only way we can do it, but not looking any deeper into it. And I just couldn't fathom why they wouldn't do that.
Well, first off, this whole tendency towards utilizing hormone replacement therapy, whether it be bioidentical or standard or whatever, it's got its problems to begin with, because we all forget or don't really consider that menopause is a natural phenomenon. And the creation of the sex hormones in menopause stops being directly from the ovaries and is directly from the adrenal gland. In the pathway to create hormones, it looks like this: cholesterol, which becomes pregnenolone, and pregnenolone becomes progesterone. It also becomes DHEA, and then it becomes testosterone before it becomes estrogen, and then it breaks down to all the other products. Um, so our adrenal glands release, the adrenal cortex releases DHEA and cortisol. So the DHEA that becomes testosterone and estrogen postmenopausally is coming from the adrenal glands. So that's should be the target of healing. Okay. And that's what we all forget, and we try and treat at the bottom end. Okay. We try and treat with the result, which, if there's processes going on that is pushing the estrogen towards the injurious byproduct, we're not even thinking of it. We're just thinking about bringing up the estrogen, okay, or quote unquote balancing it,
Yeah.
without consideration to the actual physiology. So, can you test for that? Absolutely. Okay, that's why you do the Dutch test, or any of the other, but the Dutch test is usually the better one, because it shows you the breakdown, where, what direction it's going in, and a proper practitioner will know how to intervene in that case. And as you know, and aside from giving somebody substrate, maybe DHA or something, it's all about inflammation. And once you start correcting that, and maybe supporting the adrenal glands in the proper manner, you now have a normal menopause. Yeah, things change during menopause, but they shouldn't be such drastic changes that your entire womanhood is taken away from you.
Yeah, I mean, there's so many other things that happen at the same time. And
Sure.
if it's in a compromised environment, if the health isn't great because of, people are trying to, especially nowadays, people are trying to stay younger for longer. So we've got a great commitment, seeing that's the word of the day, right? A commitment to eating less, exercising more, working harder, sleeping less. That's I've got to go, achieve, because I'm a woman in a man's world, or whatever it is they think they are. And this is no judgment, it's just the way life is. They're breaking their own selves. And very often what we see is, from a very young age, they're on the contraceptive pill right the way up until menopause.
Right.
So they're never really off of a hormonal supplement. And then everything else is broken around them. It's just that the pill is almost keeping them at a level. And then when menopause comes in, because everything else is so broken, the whole thing implodes, and it's a horrible experience.
And that's also, let's not forget about the xenoestrogens out there, where those are ubiquitous in the environment, which is going to mess with the hormone levels, create the inflammatory issue, which is creating the injurious byproducts, which is what predisposes you to cancer. If you already have a predisposition, that's what's going to set it off.
Yeah.
And that's what has to be changed. And that takes time. But when we talk about commitment and working something, a chronic illness, for 6 or 12 months or 18 months, however long it takes to normalize the physiology, guess what? What you're doing is not only taking care of all those downstream effects, you're taking care of the reasons that all happened. And when that happens, and if you're committed to making the changes and embedding those changes in your life, because they're going to make you feel good and give you your energy back, and let you think, and let you have a family, and let you have, and like yourself when you look in the mirror, if you're willing to do that, that's going to be the result, and it's going to be the result in the long term, and it's going to affect everything that might befall you in the future. It's not slow, it's not fast, it's slow, but it's worth it.
Exactly. But I think that the real thing to understand is, when we talk about commitment, a lot of people class that as something like discipline, or going without, or having to, sacrifice, and so on. In actual fact, the truth of the matter is, when we talk about it in a way that means you're now committed to do the things to change for the better, right? And what that comes about is, because we do it for over such a long period of time, there are only very tiny changes, some of which you don't even notice at first, but layered on each other, they become extraordinarily potent over a period of time. And it means that you don't actually notice it being a big change. You go, well, actually, I feel much better when I do this. I'm just going to keep doing it. And then it's not a choice anymore. It's not a discipline. You're not sacrificing enjoyment, or you're not depriving yourself. It's like, no, actually, I want to do this. This is great. I love waking up like this. And it's the commitment to going down that road that we're talking about. And to do that, you do all the things that you need to do. And because it's slow, it's like small pieces slowly over a long period of time. It doesn't.
You're changing habits or creating better habits, and you said something that made me think. You said that people are, let's say, changing their food choices, and some people look at it as a burden.
Yeah.
Just think about the prior food choices you had that made you feel horrible. Did any of that make you happy, even in the short term? You'd eat something, that within X amount of time, usually not too long, like maybe half an hour from there, you're going to feel rubbish.
Yeah.
Okay. But as you change your habits, you can look at it as being restrictive or changing your habits so that you nourish your body and feed your spirit and grow from that. And knowing that if you eat this way or do these things on a consistent basis, that you will be happier. Isn't that what we're looking for? Happiness? We're looking for joy. We're looking for contentment, serenity. How many books have been written about this? Yeah. And it all happens to be true.
So I spoke to another practitioner the other day who's on the training course that I run. She's got a patient that she's speaking to, 89 years old, and still wakes up depressed every day. Mm-hmm. Like, come on. That's not how you want to be living your 89th year.
No, you don't.
Like, that needs to be stopped ASAP, because you should be looking at life as this amazing journey, and it's a phenomenal experience that you get to share with all these great people, and every day needs to be just the most magical thing. And if it's not, people are missing huge amounts of value to being here. And that's the thing that we're trying to get into our patients. And that commitment thing about, we want a better life, basically. I'm fed up with what I'm not satisfied with what I've got. And I want a better life because I know there's better out there. I know this isn't it. There's more to life. And that's the people that obviously that we tend to come across, because they've reached that point.
But those are the ones who are the most successful at recovering from the most difficult things. But even people who don't have complex multifactorial illnesses, a lot of people are running around depressed. A lot of people are running around dissatisfied with life. And they're noticing it more now that we're coming out of lockdown. And what we didn't expect, I've been watching this since, because I also have a degree in psychology. I've been watching this since lockdown hit, and I realized at the beginning there was a lot of fear. And I was running a weekly Facebook group that, it was called, Ask Me Anything about anything. Okay. So that I could, alleviate some of that fear. But on the other end of this, people are coming out of lockdown, and they may not be ill, but they're scared, and there's a lot of stress going on, and they're realizing how unhappy their lives are. So it's another thing we're dealing with, which is all real. But
and all of that is what we do. But all of that is part of what we address. Why people think we just address the biological issues, the health issues from a biochemistry perspective, but that's a small part of what we do. The biggest part of our coaching is to get people to live a better life,
right?
Enjoy every day, be productive, be enthusiastic, be motivated. When they turn up, they actually turn up as someone of value, not someone that's like, served up in front of their kids as the stressed housewife that hasn't slept for 6 years and is just absolutely shattered and does almost goes around like a zombie every day. These are people that are looking to make that change. And that's the most valuable thing about what we do. But people don't get it. They think it's all about fixing the health. Why am I sick? Well, you're sick because there's a lot of things going on that's causing you to stay unhappy. I've said it so many times, happy people tend to be healthier.
That's true. It's absolutely true. Well, the word of the week is commitment, people. And we'll talk to you again soon. Thanks a lot, Paul. I appreciate your insights as always.
Always a pleasure.
Take care, my friend.
See you, mate. Bye.